Hi, it's Mary Beth Gilliam with the Outperform Cancer podcast. Today's topic is mindfulness, but I guarantee you this is not like any other mindfulness podcast. We're going to learn about mindfulness from an accomplished research scientist who is also a stage 4 radical remission cancer survivor. Yes, Dr. Magdalena Naylor was told she had 6 months to a year to live, but she's still cancer free more than 12 years later. She's a medical miracle, a scientist, and a bit of a skeptic. Dr. Naylor has an MD and PhD in psychiatry and was the director of the Mind Medicine Clinic, as well as the director of the Clinical Neuroscience Research Unit in the Department of Psychiatry at the University of Vermont. Okay, get ready, because now I'm going to tell you something even more mind-blowing. She's my neighbor. And although I've believed that a spontaneous, unexplained stage 4 cancer remission is possible, it is not something that I expected to hear from my neighbor. And yet, that is exactly what happened to me. I find it remarkable, but also, really inspirational because if it can happen to someone down the street, couldn't it happen to any one of us? In our episode today, Dr. Naylor talks about her diagnosis, her initial feelings of fear and guilt, and how her transition to a state of acceptance and curiosity about death corresponded with the gradual shrinking of her tumors and ultimately a complete remission. You're going to love this episode. Join me in welcoming mindfulness expert and stage 4 cancer survivor, Dr. Magdalena Naylor. Welcome, Magdalena. Thank you so much for coming today.
Thank you very much for inviting me.
We are so excited to have you because it's not every day that we get someone who is not only an expert in mindfulness, but someone who has also experienced cancer in their life. And so I'm very interested to start out with what was your diagnosis and what were the doctors saying to you when you were first diagnosed?
I was diagnosed with uterine cancer, uterine endometrial cancer. At that time when I was diagnosed, unfortunately, I was told that I have not only uterine cancer, but there are metastases to not only into my lymph nodes, in my abdominal lymph nodes, but also to my lungs. So I was diagnosed with stage 4. And my diagnosis was based on ultrasound. First was done ultrasound, and they were telling me that actually my ultrasound was fine. Later on, we find out that it was fine, that there was no change in the thickness of endometrium because actually cancer was invading the muscles, and so it was 90% of my uterus was cancerous.
Oh my goodness.
Yeah.
Wow.
So then, I had the CTs, I had the scans of my entire body, and they find out that I have also metastasis in my lymph nodes and my lungs. So we started with this surgery. First step is to remove the mother cancer, which means my uterus and ovaries. And unfortunately, they could not remove my lymph nodes because they were attached to vasculature. And the surgeon said that they could not remove it.
With that diagnosis, did they give you any indication about your overall chances for survival? What did they tell you at that time?
So I was given 6 to 12 months to live.
Oh my goodness.
And 6 months if I don't have chemotherapy, and 12 months, maybe 18 months if I have chemotherapy. So I actually was like why should I have chemotherapy? Because we all know it's a grueling treatment.
Sure.
And so I actually decided to go for chemotherapy for my son, who was at the time 25 years old, and my husband, because they both were worrying. So it was such a big surprise that I had cancer because I was very healthy. I was training for a marathon. I did not, I was training for a marathon and I knew something was wrong because I couldn't breathe well.
Oh, I see.
So that's why I went to the doctor and I say, something is wrong. But I was, healthy, 61 years old, practicing full time as a psychiatrist at the University of Vermont, seeing patients every day, doing research, applying for grants, all the shebang with the, people at the university are doing, writing papers. And here I was growing cancer inside. And I must say that I was so shocked that my cancer was so advanced that here I am, a physician, and I did not know that I had cancer growing inside me. I was breathing, difficulty breathing because I had metastasis to my lungs. I mean, what's happening? I must say, I was ashamed that I had cancer. I went to my chairman and I told him that about my diagnosis and, that I might not work soon. So you get ready. But he said, he's a psychiatrist and physician and professor of psychiatry, right now retired. And he said, Magdalena, knowing you probably will die of something else. I said, yeah, really, really. So we were laughing, but I did not let him tell my colleagues that I had cancer because I was ashamed. What is wrong with me? That I did not notice something wrong with me a few years ago. I was walking around with cancer. What is wrong with me? And that I did something wrong. It is so interesting because as a psychiatrist, I work with patients who have mental illness and they feel ashamed. Less now than 20 years ago or 30 years ago, that people were, something is wrong with me that I have a depression and I cannot get out of it. Something is wrong that I hear voices, I have schizophrenia, what did I do wrong? And parents also, what did I do wrong with the parenting that my child has depression or anxiety or something? So it's a lot of guilt about, mental illness, that we are not having enough strength to fight it. But the same happened to me with cancer.
And I've spoken to other patients about this, and I've seen it firsthand, and I've seen the toll that it takes on people because they know that if they had, a positive outlook and things that it would be better, but they don't feel that way. And they feel like somehow or another it's their fault.
Yeah.
And
or did I didn't eat correctly?
Right.
What did I do? Maybe I drank too much wine, or I ate too much meat. But I actually stopped eating meat 15 years earlier.
Oh, wow.
I was this pescatarian, and mostly, vegetables and I like from time to time, chicken and fish. But, it's like, oh, stop eating meat. I already stopped eating meat 15 years ago. Okay, exercise. I exercise. I go to yoga.
Yeah.
I do this. So what did I do wrong?
Right.
What did I do wrong? So it's like, people who have diagnosis of any medical illness should not make any assumptions that it is their fault.
Yes.
That they did something wrong. It's just like when we got the diagnosis. Yes, check what you're doing. Maybe you need to improve. If you're more sedentary, you need to increase your physical activity. Yes, if you eat too much meat, maybe you decrease, but this is not like it. We can pinpoint that. I think that those are mutations. I had mutations in my body.
Yeah.
And for who knows, I don't know.
Who knows how?
You know, maybe it is some microwaves or something. I don't know. But I did not do anything, on purpose or neglected my health.
Right.
But it took me a long time. It took me about 2 to 3 years to finally, even this interview, it was not very easy for me because I felt like, telling my story to other people, like openly. So thank you for breaking this, my reservations to speak up.
For all of you out there, Magdalena is not only a doctor with a PhD, an MD and PhD, she's also my neighbor. I had been looking for those hopeful stories. And it's one thing to read them in a book. I've read lots of books like Radical Remission and The Awakened Brain by Lisa Miller, and all of these stories that were about these incredible people who've kind of overcome their cancer diagnosis and for some reason are continuing to thrive. It's one thing to read it in a book. It's another thing to find it down the street. So for all of you listeners out there, what I want to say is I have to believe that if I can find someone down the street who is a cancer survivor well beyond any timeline that they were given, you can find someone down the street too. This is not, I cannot believe that this is the only situation. And so I want you to listen to Magdalena's story, and I want you to think about it as this could be the person next door to you.
Yeah, because it's that's a very interesting how you put it, that that we read books and it looks like it is some evenement, rare, and physicians also kind of participate in this scare
Yes.
of that cancer is, especially metastatic breast cancer or any cancer metastasis, is death sentence.
Yes.
And that's how when I got the diagnosis, I was scared. First of all, I worked with patients with chronic pain. And my expertise was teaching them relaxation techniques, meditation, and mindfulness, and to decrease the stress from pain. And, the results shown that if they are less stressed, they felt less pain. And I was able to actually take them off opioid medications at the same time to decrease their perception of pain. And, I published those results. And then next step, I published that there are changes in the brain correlated with the higher level of functioning and less pain. Yes. So I knew that, but I also knew patients with chronic pain and cancer and the pain. I was actually scared of pain.
I see.
I was not scared that much of dying, but how will I die?
I see.
But I also was scared of dying because I had dreams of people shooting to me. I was in dark alleys, and they were cars with people with guns and shooting to me, and I was hiding. And I was waking up in panic, and I knew, like, okay, Magdalena, you're afraid of death. You're afraid of death. And I was trying to work on that. But it's not very easy when you go through surgery and this and that, and they are giving you 6 to 12 months. And then you start going admitted to the hospital for the chemotherapy for 3 days, Wednesday to Friday. You're in bed, lying down, with under the Benadryl, half awake, half asleep. How are you going to work with this? Said like, I'm not afraid of death.
Yeah, right. It doesn't create an environment conducive to thinking positively.
But I also was, cocky.
Yeah.
I was like, I am psychiatrist. I work with this. I work with that. So I don't need any extra help. I had my teacher, meditation teacher, Shinzen Yang, who is right now, I think, somewhere in California. He left just before pandemic. And so I was consulting with him.
Uh-huh.
But, it was like, oh, I know how to meditate. Yes.
Yes.
And then the other thing which happened is that I asked for a dog. And I got my dog, little dog, Zorba, because I was going to lying down in bed upstairs in my bedroom. That's why I was imagining myself. Yes. Lying down in bed by myself. My husband will be downstairs cooking something for me, or working in his office. And I will be there by myself, watching TV.
Yeah.
So I said, I need to have a dog. So we got a dog. And 3 months after my diagnosis, I was driving. This was already, the spring. I was diagnosed the mid-February. Then diagnosis. Then I had a week, 10 days later, my surgery. Then you need to wait for about a month to start chemotherapy. I agreed for the chemotherapy. Like, okay, let's go. And I was not very like, okay, I'm having chemotherapy.
Yeah.
I'm doing it for my husband and my son because they are telling me I'm gonna die anyway.
Right.
But then my oncologist said, Magdalena, you are a scientist.
Yes.
Those are the statistics, but you might not be. You might be just this one.
Yes.
Who will survive.
And that is so important to really point out that those statistics might be valid when you look across lots of people, but that does not mean that anyone can predict an N of one.
Yeah, N of one. And I said, oh, okay. Yeah, okay, so I will go for chemo. You are right. So So I was already doing chemotherapy. I was bald because I lost all my hair from my entire body. And I was in that white dress and I had little Zorba, my little puppy dog, on my lap. And my husband was driving a car and we were driving down the road in Vermont here in Charlotte. And there was a place that I was riding horses. I was learning how to ride horses. Then I had to stop because I had back pain. I did not know why I had back pain. I had cancer. But we were all treating my back pain. Nobody was thinking that what's the cause of it. Yes?
Yeah, right.
So I'm driving there and my husband is driving. He's very careful driver. He doesn't look like, talking about, we were not saying anything. He's driving and looking straight, and I am looking to the right at the horses, and I feel like this acceptance came over me. And when I am moving these hands up and down, that's how I felt, that it was coming from the top of my head and going down and through my entire body down to and I felt that I accepted death. The acceptance was so beautiful. And I'm thinking like, wow. And I am a scientist. I am not like looking for some divine, and premonitions and divine thing or that. No, I am a scientist. And then my husband looks at me and said, Magdalena, what just happened? And I look at him and I was like, what do you mean? Just something happened. And I said, oh, I just accepted death. And he says, oh, that's good. It wasn't it.
Now, was it you used your hands to go kind of indicate that something was coming over you? So did it feel physical? Did you feel like a physical change was happening?
Yeah.
And what were you thinking at the time? So you were quietly in the car with your dog. Did it surprise you? Were you thinking, I'm going to accept death now?
No. No. I was thinking like, oh, the horses. Oh, it's like, just looking through the window. And this just out of nowhere it came. And it was, I cannot explain because it just, this acceptance came. I never heard that, if, experience anything like that. You know, if somebody says it's radical acceptance, it is radical acceptance, but I was not working on it. I was not doing anything. It just came over.
It just came over you. Now, leading up to that, you had you been starting to think about acceptance and
No.
working? No.
No.
It just
I am not this kind of meditator. No. Okay, they were talking radical acceptance for pain, for this. I have to tell you, I was rolling my eyes. And I hope that nobody could see it because I didn't want to offend anybody. Things like that were for me like, mambo jumbo.
Okay.
So, no. This was like, whoa, what is happening? But then, I mean, even when I'm talking to you about, I have goosebumps in my entire torso. So I think that was the beginning of healing.
Yeah.
And then I said, wow, I am still young. I am not demented. I am generally speaking healthy.
Yeah.
Okay, my heart, my kidneys, my liver, unless they damage it with the chemotherapy. But otherwise, I am fine. So I started to be curious about death.
Okay.
I wanted to. So from that, acceptance is one thing, and then it turned into curiosity. And I started to talk to my husband how I want to die. My husband was 14 years older than I. So death and dying was not a new subject.
Yes.
We had wills, we had this, we had that. He actually, as an economist, he was actually like, okay, so here we like,
so he was very prepared.
Well, he was very prepared. And so, but it was economically, financially, but also, how we want to die. Not an extra heroic measures. We both knew that, it's not going to be lying down there on, life support and stuff like that. We all both agreed for that, but we were talking about it, and I was saying, because I am gonna die in pain. I know I'm gonna die in pain because I have cancer. That was my belief. And I said, remember, you need to keep me conscious. You cannot knock me out with morphine that I don't know why I'm dying. I was thinking that I need my consciousness in order to experience death.
I see. Yeah.
I'm a scientist. Yes.
Yeah, right? Yeah.
So people who are not conscious, they don't experience death. It's only conscious. How stupid.
I don't know that that's stupid. I think I understand wanting to have awareness at that moment.
Yeah.
Because it is the biggest scientific mystery.
Yes, it's scientific mystery. I wanted to have this experience.
Yeah.
So a month later, I am talking in person to my meditation teacher, Shinzen, and he said, so how are you doing today? You seems to chipper. I said, yes. I said, I'm not afraid of this anymore. And actually, if anything, I'm very curious about it. And he said, you are fine, Magdalena. I don't need to teach you anything else. I said, well, I'm fine. Yes, I don't worry about you. I don't worry about you.
So that was a big moment. That transition from fear to curiosity. It's a big moment.
From fear to acceptance to curiosity.
I see. Okay. I can relate to that in that As you know, I do a lot of research,
Yeah.
and I am curious about everything from how does cancer work to, okay, if we understand how it works, then how would you go about shutting down those pathways and trying to understand both, traditional as well as non-traditional ways to shut down those pathways. But a big personal interest that I have is how we use thought and our minds to help or hurt us.
I think that those experiences happened more often than we
Vocalize.
aware. It's just that when you are not open for those experiences, both religious, spiritual, and emotional, you might miss it.
Yeah.
You
Right.
know, you can go for a walk in the woods and be preoccupied with your mind about something that you worry. You miss the beautiful flowers, you miss the singing birds, you miss a lot. The same is with our experiences. What's going on here I'm looking same chess, but what's happening in our mind, what we think about, how we feel about it, emotions, and also how our body experience that. Yes, because the body, and that's how the mindfulness works. You need to be aware of what you're thinking. Yes, and be non-judgmental. We keep judging everything. This is wrong, this is right, I am not right, this is not, you are not right, or you are right, I am wrong. Even when we put the right judgment, it is judgment.
Yeah.
And I think that being non-judgmental is so important to release the stress. Yes, because worrying is causing stress. If you think worry is our thinking, and then there are feelings. Yes, sometimes people don't know that they have worries. They might not be aware, but they might be aware of their heart palpitations, the feeling of anxiety, claustrophobia, agoraphobia, whatever. I don't want to live outside. I don't want. I am afraid to stay inside. I have panic attacks, but they don't know what is going on in their head. There is another third group. They might not know that they have a problem up here and up here. They only feel the problem and stress in their body.
I see.
Pain.
Uh-huh.
Pain is one of those. Knowing that our body is one with our feelings, thinking, and our bodily function, our heart, our lungs. Said that, it doesn't mean that we are causing the cancer, but we can, through our change of our thinking, our feeling, we can also decrease the stress response and all the corticosteroid going down and cortisol level going down. And by doing that, we are, I think, more receptive to treatment.
Yeah, right. I try to think about it as an opportunity, just like exercise is an opportunity and lots of different therapies are opportunities, the opportunity to eat well, for example, that being able to release that stress is an opportunity to help your body heal.
Yeah. And your mind.
And your mind.
Because emotions are our physiological experiences. We don't even know that we are influencing, that actually we feel fear, but this is the heart rage, and all of this is so still mysterious, for the even scientists, how our body functions.
But I have an important question for you. So you said early on that you felt some guilt when you were diagnosed. After the feeling of acceptance of death, did that disappear or change?
Yeah, they changed, and I started to talk openly about my diagnosis with other people. I mean, I was not talking details, but The most important is that I did not feel guilty.
Yeah.
And this was guilt is also stressful.
Yes, it is.
And so it's just after that acceptance, I was really not stressed.
Mhm.
And when people were telling me, oh, it's like we don't, after we get the diagnosis of cancer, we find notice that the grass is green. And it's true, uh, prognosis of 6 to 12 months. It's like, okay.
Yeah.
But some people drop everything and they change their life
Mhm.
and they live differently. I decided to continue exactly the same.
Mhm. But you did,
No, as far as work.
right, as far as
Yeah.
work, but you did make a couple of trips. Like you did do a couple of things
yes,
that
you're
were
right.
stepping out, right? So you didn't change your daily life, and that you kept your job,
Yeah.
and things like that were a normal pattern of life for you. But you did shake things up
Yeah.
a little bit. Why don't you talk about that?
Yeah.
And the impact that had.
Yeah. So you're right. It was a friend of mine had her annual trip to Uganda. And she was, a director and president of the nonprofit organization helping pregnant women in Uganda. And her team was setting up clinics for the ultrasound clinics in Uganda, in different parts of Uganda. And she said, hey, would you like to go with me to Uganda? And I said, yes, I'm coming home. And I said, Thomas, I'm going to Uganda. And he almost hit the roof. You mean you have very weak immune system because you are doing chemotherapy and you are going to third world country? So he could not believe that I'm doing, and he thought that I lost my marbles. I mean, how the physician would do this?
Yes, sure.
And going with the other physician.
And you were in chemotherapy at the time?
Yes, every 3 months I was admitted to the hospital.
3 months or 3 weeks?
Oh, sorry, 3 weeks.
Yeah.
I was admitted. So I could go there only for 2 weeks to come in between.
Yeah.
And then have labs and all this and that. So, and I said, Thomas, I am very sorry, but I'm going.
Mhm.
I just feel like I need to go. And he was, I did not know, but he was calling my oncologist. I knew that I have to do it. So I called my oncologist and said, I was not actually truthful. I said, there is a meeting in Uganda, meeting like, research meeting.
Right.
There is a meeting. Can I go? I said, let's go. Later on, he said, you have 6 to 12 months to live. Go.
Right. Like what's the downside, right? I mean, that is kind of freeing, right? There are parts that
but I felt good because I had his blessing, yes?
Yes.
But Thomas was calling, my husband was calling him like, how you can? Because I told him, no. My oncologist said, fine.
Yeah. Yeah. So tell me why you felt you needed to go.
This is very interesting. First of all, I did not want to change much of my life and my professional work and my, but I always traveled a lot. And I did not want to miss this opportunity to experience not only just the travel, but to have an experience of people doing something good for other people. We were doing this for pro bono.
Mhm.
I wanted to experience that. What does that mean? And guess what? When I came back from the trip, my husband said to me, Magdalena, you were right that you went. You are a different woman now. So I was looking that says like, what do you mean I'm a different woman? You are beaming.
So what was it that you experienced there?
The gratitude. The gratitude of those women for helping them. And I still have, if you push me, I would cry now. Because this was, I did not do much per se, because I was still ashamed that I was bald. I had my turban, on, and then after a while I just took it off and it's like
Too hot.
and no, I this is not only that. It's just like, why am I ashamed of that I'm bald?
Yes, sure.
What happened is that I felt privileged that I could be present. Mostly I was present. And we started at the time of the ultrasound for breast cancer. And those poor women, some of them were coming too late when there is already discharge, bloody discharge from their, but we were able to help them because, in Uganda at the time, if you had diagnosis of cancer, there was an insurance to treat it.
Okay.
But there was no insurance to cover for the screening.
I see.
And
So
diagnosis.
it's like, how do you get the diagnosis? Right.
My role was to teach women how to do breast examination. So come, if you have those, the lump, you need to come and we do ultrasound and we will find out if this is, solid or this is, whatever. So I felt so blessed by being able to be with the team and, even support the team emotionally, and we were traveling like sometimes 7 hours one way in some jeeps, and having flat tires in the middle of nowhere, and but all of that, I did not worry at all because I was gonna die anyway.
Right. Yeah.
Sooner or later. But then I came and my husband says, it was so important that you went. And I think that, doing something, not only worry about yourself, but when you have this kind of, chronic illness, giving to others, it's also important because, my husband noticed that.
Yes.
It was not only my personal feeling that I gained something. It was visible for others that I was calmer, that I was happier, I was more accepting, was not that stressed. So working on stress of cancer and, this diagnosis and then prognosis and everything, it's not only just sit at home and meditate.
Right.
Oh, no.
Right.
You can do walking meditation, just be aware of your being non-judgmental, giving to people if you can.
Yes. And I think that it's, it can be really small things.
But like what you are doing, okay? You are trying to give other people's experience or expertise and share through those videos.
Yeah.
So that is important. It doesn't have to be going to Africa.
Right.
I just had this opportunity.
Right.
The other step, when you mentioned another trip, was to, I always wanted to go to, I love traveling in Asia, but I always wanted to go to Tibet. And I never had this opportunity. I was just like, I was in Nepal before, but it was close to Tibet, but I couldn't go. And, one other thing what happened is that I was diagnosed with cancer in February, but my husband actually had stroke in December. So less than a year, I lost my husband, who was my pillar, my rock. And so he had a stroke on Sunday and died on Wednesday, 3 days later.
And that was, had you finished cancer treatment? Had you finished chemotherapy?
We put at the time on hold because my oncologist said, why don't we just put it on hold? Because sometimes if too much of chemotherapy, you might, there is might be more risk than benefits.
I see.
So I still had metastasis to what happened is after
Yeah.
after my return from Uganda, when I had a month later, because it was like at the end of August, so a month later, I had my CT scan and they told me that my lymph nodes are shrinking. And I said, like, how is it possible? You told me that they were calcified, that you could not take them out. Do you left those lymph nodes out there in my abdomen? And now you're telling me that they are shrinking. How is it possible? So I was just like, what is this with this medicine?
What about the lung tumors and
The lung, they were very tiny, but they were like all over. So if there is one or two bigger, you can take out part of your lung. But those were like just really small. I call it like the what is it? Candelar? Colander.
Oh, like a colander. Yes, right.
My lungs look like colander. Like
yeah,
I couldn't take it out.
Okay, so and that was still there on the CT
It was still
scan?
there on the CT scan.
Mm-hmm.
So, and we decided that, not everything can be fixed with the chemotherapy. Let's leave it.
Leave it.
So we actually were a little bit hopeful that I might maybe live longer than 1 year, than the 12 months. So my husband and I were actually making plans to go to Luxembourg. The Prince of Luxembourg invited my husband to some kind of conference, and in March we were going to go there.
Okay.
So like a year after my anniversary. So we're like kind of, maybe I can go with you.
Yes, that would be nice.
And so, but I just finished like November date, and so I was still bored when my husband passed away.
So your husband passes away completely unexpectedly, very suddenly. And that must have been devastating. I know how close you were.
It was devastated, and then after a few weeks, I was thinking, hey, he's dead. I am going to die anytime soon. So, I am not religious. I believe in higher power. I believe in, because, it's just, if Einstein believed in higher power, I believe in higher power. But I was thinking, like, if there is something, we will be together.
Yes.
So I was actually not grieving his death as I supposed to.
I see.
Because I am going to meet him soon.
I see.
And then in May, there was a party that I met somebody who were planning to participate in a trip to Tibet.
Oh.
So,
and now your life, you've gone past the 1 year mark.
Yes.
And so,
but still, I have still metastasis to my lungs.
That's right. And you're not getting, did they start chemotherapy up again? No, they just basically
because we were observing it and those metastases were not growing.
Okay.
So if they increase in size, we would restart chemo.
Okay.
But we decided,
let's just wait and see.
We'll see.
Yep. Sometimes I do that. And
then I was fine with that. And I find out the group who were going to not only to Tibet, but also, Mongolia, Tibet, Nepal, Mustang, and Bhutan, following the footsteps of Padmasambhava. Padmasambhava is like a second Buddha who brought the Buddhism to Tibet.
Okay.
And so I just wanted to go to see the culture, and that was my go to Tibet. So I convinced them that they need to have a physician in their group. I'm kidding, especially a psychiatrist, There were dancers there, there were poets there, there was the man I met, it was a filmmaker. And then I kind of find out who is a sponsor and director of that. And I met with him and he says, okay.
You can come.
You can go. And this was amazing because we were going to places which supposedly Padmasambhava was meditating. Padmasambhava created, a group of monks that they were following his teaching and steps. So I was in so many holy places for Buddhism, and especially the Tibetan Buddhism, that, I was listening to chanting, I was listening to prayer, to meditation, and meditated with those people in their, we were hiking up in the mountains to stay and meditate in the caves that he was staying for years.
Wow.
So, and but I was just going.
Yes.
Doing all of that. I was not thinking this is going to help me in any way. That was not my mission. My mission was experience, because I was practicing meditation, but I was not considering myself a Buddhist. So, this is my usual nature. If I go somewhere, I'm curious about things.
Sure.
And I want to see, how other people experience that. And their art, their painting, and their chanting. And I knew that was helpful for anybody. So when I came back from that trip, a month later, I had follow-up. And they say, Magdalena, your metastases are shrinking in my lungs. And I was like, what? I did not have, and it was like a year after I finished my chemotherapy. November. And I said, like, no. And that's when I said, you misdiagnosed me. It's not possible. You were telling me all this, differentiated cancer and this very, invasive and this, I don't believe you. I am sorry, you made a mistake. And I said, I need to have a second opinion. So we said, and then my colleague, which I knew, pathologist, said, absolutely, Magdalena, maybe I misdiagnosed. But she said to me, I was like, whoa, because she knew me and she sees these cancerous cells. And she's, so look, a team was looking for those diagnoses, not just one person. They brought it to me. Look at this.
Yeah. So
she was a director of the lab.
And you worked there. So they knew you.
Yeah.
They cared. Sure. But
so I said, you need to send it somewhere. So we had 2 or 3 options, and they decided that MD Anderson, they are actually experts in this particular type of cancer, and they sent it to them. I was sitting on my hands.
Yes.
Waiting. Maybe it is not cancer, yeah?
Right. Yes.
No. They confirmed the diagnosis.
So MD Anderson confirmed that you had metastatic cancer and that the type and subtype were exactly what they had thought, that it was uterine cancer and that had metastasized. Yeah. So you now have this confirmation that, sorry, Magdalena, yes, it is indeed cancer, but you have this awareness now from the scan that things are mysteriously shrinking, and so what does the doctor say? He just
they just said, we don't understand it.
So they did it and they said it was shrinking. How long did it take before it just disappeared? Like they couldn't see it on the scan.
That was, then I started to have not every 3 months CT scan, but every 6 months. And so it took about a year.
So in a year.
And now I don't have anything.
So you are completely cancer-free.
I don't know. With cancer, you never know. There is one little cell floating out there.
Right.
Will attach to something. I don't know.
Nothing
visible.
Nothing visible. I know. I like to say no evidence of disease, but then some doctors say, well, if we look at your scan and your spine, we can still see these sclerotic regions. But
sclerotic, this means it is healing.
Right.
It means that it is a scar. Okay. Right. So it is different, and but so active cancer looks different and the scars look different,
right.
too,
So you have no active cancer now, and basically about a year after you stopped chemotherapy or so, was it about a year
that it started to shrink,
and then
another year,
and it just kept shrinking and resolve until it was fully resolved.
Yeah.
Wow. That is, I'm sure people have told you it's a miracle.
Yeah, it's a medical miracle.
A medical miracle. So what did you do? What were you thinking? Were you surprised?
Yeah, I was surprised. Because, I am a scientist and it doesn't fit my perception of how body works, yes?
Right.
I stopped chemo. I went for the trip and then, so we don't know, yes? What is so wonderful about this is that life and death is such a mystery that we do not know.
Mm-hmm.
And what helps?
Right.
I say my Zorba, who is right now 12 years old, he was helping me.
Your dog?
My dog Zorba, the Greek. My trip to Uganda, but also chemotherapy.
Yes.
I cannot dismiss that it's chemotherapy.
Yes, sure.
And I tell you that my husband, as in this also scientist, economist, PhD in economics, published many books and he was talking to his friends and their friends recommended another friend who was sending me to, they wanted me to go to Mexico, having some IV fluids, some saline.
Yeah. Right.
I was saying like, thank you. I am not going for anything like that. No.
Right. So did you do any other alternative treatments like, taking turkey tail mushrooms or doing, having, juicing like carrot juice and beet juice?
I was doing a lot of juices. Yes.
Oh, a lot of juices.
Yeah. Okay. I bought this juicing machine that I can do carrots because not every machine juicer can do carrots because they are very hard. And I was just beating, juicing, carroting. I was yellow.
You were yellow. So you did do more so the things that you did as adjunct therapies were food based. You made healthy food choices for vegetables, fruits.
But I had to tell you, I always loved having juices. If I eating fruits and vegetables all the time. Mm-hmm. I don't like sweets.
Okay.
But I can eat 2 pounds of grapes, which has a lot of sugar.
Uh-huh.
Yes, I love those, and so it's but of course I increased the number of my juices, that I was, not maybe twice a week, but I was doing it every week, every day.
Uh-huh.
But it was not like I was just doing one, apples and this and ginger, what I like. I was not thinking that, that I just wanted to be. I actually, when I was doing chemotherapy, I gained weight. Mm-hmm. Because I was so tired from chemo. I could not do my physical activities as I was not right. I couldn't ride a bike.
Yeah, right.
When I was doing chemo, I was just I had side effects, I had neuropathy in my legs. I wanted them to cut off my legs. They were changing the chemotherapy every few weeks because I was not responding at first, and then there was something else, and it's like, so I was like juicing, eating healthy food. It was like, and I was gaining weight. So people, and I was like going on follow up, and it's like, what? I gain again? That's good. That's good. I was like, no, that's not. It's not good.
But you were doing it with healthy food.
Oh yes. Oh yes.
It was with
Yes.
healthy food.
Very healthy food. Again, vegetables and juices. But I was not doing it, with the purpose like, oh, this is gonna be,
I'm going to cure myself
Yeah,
with carrots.
yeah, no.
No, it was just eating healthy, doing what you want, trying to make a more conscious effort to keep yourself just healthy
Yeah.
and eating what you like.
Yeah.
Fruit
And
vegetables.
any of that, what I was doing, it's, for the trip, it was not like, oh, maybe I will prolong my life.
Right.
It was a completely different objective. Objective was to live my life fully.
Right.
And to do what I like doing. And I continue working because I liked working.
Right.
I liked my patients, even some of them very difficult, suicidal and angry. And, I like to help them. So I liked my job. So I was doing what I liked.
Yeah. Right.
Not because of money or anything, I was lucky to have a job that was my hobby.
Right.
And it still is my hobby.
Mhm.
So I decided to live my life fully, explore everything I could.
Your experience and just hearing your story helps me, and I think it will help my listeners just in hope itself. I mean, just knowing that this happens is an amazing thing. But I also know that you have spent a lifetime working with patients and helping them understand mindfulness and how that helps them in their life. Is there anything that you can tell cancer patients specifically about mindfulness, how they might be able to use it in their own lives?
I think that I already mentioned that very important two things in mindfulness is to be present in your mind and in your body, emotions, and be non-judgmental. So the mindfulness, it's my mind. Yes, mindfulness is being mindful it's a practice of the mind. And so to be present, not thinking about something in the past. Like, for example, in my case, I was thinking, what have I done? Because I was raised Catholic. What have I done to deserve it? Yes. So this is this guilt coming. Maybe I did something. All my sins I remember.
Right. Yeah. You're the only one.
I was not sinless life of 60 years, I made mistakes and, so then you are stuck on your past.
Yes.
So you are not present because you think, what have I done? Or what I have not done. And regretting that you did not achieve this and this and this. Oh my God, I'm going to die of cancer and I did not do those things which I was planning. Yes.
Yeah.
Or you are thinking about the future. Oh, I am afraid of dying. Oh, it's going to be painful. That's what I was doing. Yes.
Yeah.
So you're not present because you worry about what the future might come.
Right.
So that is a no in mindfulness. You need to be present. Means, what do you smell? What do you hear? What do you experience? How you sit right now? Do you feel? What do you feel with your thighs? Okay, be aware of your body too. Body is important. And give us a lot of information. Maybe I need to change the position when maybe I am not sitting correctly. Maybe I am breathing too fast, and hyperventilation causes me to feel anxious. So be aware how I breathe, what I think. And then again, said the second thing, to be present and being non-judgmental. So no judging yourself or judging others, because a lot of people who have also the chronic mental or other illnesses, they blame on others. Didn't treat me well. They were this, somebody rejected me. No, that is judgment.
Mm-hmm.
So that was so fantastic for me, that I had this spontaneous acceptance, because I did not have to work on this, being non-judgmental.
Mm-hmm.
When you have acceptance of your life and death,
Mm-hmm.
you stop worrying about the past or the future. You're just enjoying your moment.
You know, there was one thing you said to me once when we were chatting, that I want to just capture, because it had a big impact on me. And that was talking about resignation versus acceptance. Can you talk about that a little?
Yeah, that's a good point, because, for years I was really teaching this to my chronic pain patients, because they very often they were accusing me. You just want me to resign and just lie down and turn over and die? No, no. Acceptance is different. You accept that you have the pain, or that you have cancer, okay? But you continue working on it. Healthy eating, breathing, relaxation. You do not kind of roll over and die, resigning. You continue working and making this very, happy death.
Yeah.
We don't want to die unhappy.
Right. Right.
Yes. Happy, the Camus, that's what he was saying. No, it's what it is to die happy, not miserably,
Right.
but happy. So we may not have a good life, that what we did not achieve what we expected and all that, we might be grumpy. But when this comes, like the diagnosis of cancer, okay, ask yourself, how do you want to die and feel happy?
Mm-hmm.
Not resign, but what's the surroundings? What do you want? Who do you want to spend time with? Who are your friends?
Mm-hmm.
Who are your people that you were your friends and you didn't contact for a long time?
Yeah.
And you don't have to say, look, I have cancer, so I'm calling you to tell you, to express my gratitude for something you did 20 years ago, just to call.
Yeah. Right.
And have a chat and have an uplifting. So, how are you?
Right.
How are your children? And this brings joy.
Yes.
So then, no, resignation and acceptance. I can accept and still do a lot to get better.
Yeah, it does. It comes back again to me for action.
Mm-hmm.
It's the difference between letting our minds just wander to bad places, in the past or in the future, and worry when worry doesn't improve anything. Whereas,
But also action, like what kind of life we live. Like, do we eat healthy?
right,
Yes. Do we exercise?
right,
So resignation, it is really like, I resign and I'm accepting this, I'm gonna die. No,
right.
I might die, but I don't know when I'm gonna die.
That's right.
So let's have, the last, few weeks, few months, few years,
Yeah,
the way we want.
that's right. That's right. Not
With
worrying
people we
about,
want, with people we want.
not worrying about the future.
So that is what you said, the action. Okay. We still have, you can make decisions.
Yeah.
What we want to do, how we want to do, how we want to feel. You can feel miserable,
Right.
but it's really your choice. I was listening to somebody who was diagnosed with cancer, and still has this cancer, metastatic cancer. And he said that physical pain and psychological pain, and he's not a psychiatrist, it's so different. And he was right. He said, in midst of physical pain, you can feel joy.
Mm-hmm.
not happiness.
Mhm.
Because having physical pain, it's not happiness.
Yeah.
Unless you are a masochist. But you can have joy about something. So somebody comes and you can have physical pain and you still have joy of seeing that person or
Yeah.
hearing the beautiful music,
Right.
you know, seeing beautiful pictures.
Right.
And you can have the joy.
Right.
When you are very depressed and unhappy, you know, the mental part, you know, of our, then, you know, if you resign, then there is no joy. So the mental, we need to really pay attention to our mental health and our mental strengths.
Mhm.
What is meditation? I say to my patients, I don't try to make a Buddhist out of you. If you are Christian and you pray, keep praying.
Mhm.
Just increase it to twice a day for 15 minutes or 20 minutes,
Uh-huh.
morning and evening. Not like, oh, give me, but pray like you really truly pray to and communicate with higher power, with your God.
Mhm.
And this is your meditation. Doesn't have to be mindfulness or some other type of meditation. It could be really your religion. That's what it is. Praying is meditation.
Yeah, for sure.
It depends how you pray.
Mhm.
And if you pray well, you're done for today.
I think that is a great place to wrap up. We're really grateful for your time today.
Thank you
and
very much
the inspiration that you provide. I just want to remind the listeners that we are each an N of one. And so when you are provided statistics or when you go on Google, inevitably, and every cancer patient does and looks at the statistics for your diagnosis, I want you to remember you are unique. And while science has lots of predictions based on large groups, each of us is an individual. And there is no scientist that can predict exactly what will happen for you.
Thank you.
Thank you.
I wish you all who listens to us the best outcomes in your diagnosis and your future. And to keep practicing.
Keep practicing. Thank you.
Thank you.
And now an important announcement. All the information that was provided today was for educational purposes only. I'm a patient, just like you. I am not a licensed or accredited physician, therapist, or clinical researcher. All information provided is not intended as a substitute for the advice of a physician, therapist, nutritionist, or any other qualified healthcare professional.